My name's Arthur Stephen and I'm one of the consultant orthopaedic surgeons in the Trauma Orthopaedic department at the Derby Hospitals. We've made this DVD to help give you extra information about your forthcoming hip surgery. You will soon be having your hip operation and it's very important that you read the book that you've been given. We would also like to help you prepare for the operation and your recovery afterwards by showing you the departments, what happens there, the staff that will be involved and some of the care you'll have before, during and after your stay in hospital. Pre-op area. You will be asked to attend the preoperative assessment department. Some patients, but not all, see an anaesthetist here and the surgeons, but all patients are seen by the specialist nurses in the department. Here, your general health will be assessed. The nurses will record your details, tell you about the surgery and your pain relief afterwards. They will take blood from you, answer your questions and perform tests like an ECG. These are all routine tests and investigations ready for your operation.
Hello, my name is Boam. I'm a care assistant and I work within the preoperative assessment unit. My job is to do all your tests and assessments before your operation.
Some patients are asked to go to the therapy department to be assessed by an occupational therapist who will decide with you what equipment or help you might need at home after your operation. The occupational therapist will also advise you about what you can and cannot do after your operation.
Hello, I'm Judy, Corby, one of the occupational therapists. You might be seen by an occupational therapist at your pre-op assessment and perhaps at the prehabilitation hip class and certainly during your stay in hospital. It's our job to make sure that you can manage your everyday routine with your new hip.
Prehabilitation class. Some patients, but not all, will have an appointment for a separate prehabilitation class. If you are asked to come to this clinic, the physiotherapist will show you how to use walking aids, how to get in and out of bed, and will watch you practice. You will be given the crutches to take home and use before your operation, and you will bring these into hospital with you. Being able to use these aids well and being familiar with them is a very important part of making a speedy recovery.
At the prehabilitation class, a physiotherapist will teach you some very basic hip exercises. It's a good idea to practice these exercises before you come in to have your surgery, as you will need to perform them every day once you've had the operation. I'm going to use Hilda now to demonstrate some of these exercises. If you come across to the table, Hilda, and just hold on with your fingers. When you're performing these exercises, it's important that you're holding something safe and secure, just in case you were to feel a little bit wobbly. And the exercises are only for the operated side, so the side that will be having the surgery. What I want you to try and do is keep your knee nice and straight. And first of all, we're going to lift your to-be operated leg out to the side away from you, as far as you can comfortably, and then bring it back down again. And you should aim to try and do at least a set of 10 of these within your comfort levels. Okay, so just have a go at doing a few. Well done. And the main thing to be careful of is that you don't tip over. Every time you're lifting your leg, try and keep your body nice and central. Well done. Often before the surgery, you lose the ability to stand nice and straight and also to move your hip into what we call extension. So this is an exercise to make sure that we're stretching out all of the muscles at the front of the leg. What I'd like you to do is take your operated leg back behind you and then back to the floor. Well done. And again, while doing this one, try not to dip forwards, but keep your body nice and straight. Well done. That's great.
After your operation, there are certain things...
Also at this class, the occupational therapist will explain the hip precautions you will need to follow after your operation.
To reach down to the floor or to get anything out of the leg cupboard or drawer. I'm going to show you a way of doing that without putting your hip under any undue strain, and then I'm going to get you to try that.
You will also be seen by an orthopaedic outreach nurse who will talk to you about your care, going home, and will answer any questions you might have.
Hello, my name's Judy. I'm a member of the Orthopaedic Outreach Nursing Team. We may come and visit you at home, or we may give you a phone call once you've had your operation done and you've left hospital.
Admissions area. You will come to an admission area on the day of the operation.
Would you like to take a seat and someone will with you shortly?
Thank you.
Okay, see you soon.
Nurses will check all your details, record your temperature and blood pressure, your pulse, and help you to get ready for the surgery.
Right, we're just going to pop your gown on. That's all right. There we are. If you'd like to just turn round and we'll tie you up the back. Hello, I'm Jane Archer. I'm one of the ward sisters on the Orthopaedic admissions unit, and you'll see either myself or one of my colleagues when you're admitted to hospital, and we will prepare you all ready for surgery.
A doctor will mark your skin to highlight the area of operation. You might also be seen by the anaesthetist at that juncture.
Right hip, is that correct?
That's correct.
Okay, right. Now, we had a good chat then and went over things. Do you have any questions whatsoever you want to ask me?
I don't think so. I think you explained it quite comfortable to me. I don't think there's anything really.
Okay, fantastic. So the final thing to do really is that we need to draw an arrow
Yeah.
on your hip.
Okay.
So if you just stand up. I'm afraid it has to be a large arrow.
It's all right.
Okay, I shall see you a bit later.
Thanks a lot.
You can have a seat again now.
Thank you very much.
Bye-bye.
Bye.
Theatre department. When it is time for your operation, a porter will take you on a trolley or in a chair to the operating theatre department.
Morning, sir. How are you this morning? Okay, my name's Sharon and I'm going to be looking after you today, okay?
The receiving nurse will check all your details with you again, and you will then go through to the anaesthetic room where the anaesthetist will talk to you and give you medication.
Hi Mr Riley, hello again, hi. So as I explained to you on the ward, first thing we're going to do is pop a drip in the back of your hand, okay, we'll pop that on the other side. Then we'll swing your legs round and prepare your back and pop this injection into your back.
Okay.
Okay? Hello, my name's Dr Marvel, I'm one of the consultant anaesthetists. My role is to assess you for your operation, to obviously perform the anaesthetic, to look after you during your operation to make sure everything's nice and stable, and then make sure that pain control and symptoms like nausea are adequately controlled to allow early immobilisation to optimise your fast recovery.
You will then be wheeled into the operating theatre, where the surgeon and theatre nurse will be waiting for you. Many patients have a spinal anaesthetic, where you are awake but unable to feel any part of the operation at all. If you wish, however, you can choose to have some sedation during the procedure so as not to hear the operation taking place. Before the operation starts, a large screen will be put in place and the staff will work behind this for sterility reasons. Once your surgery is over, you will be taken into the theatre recovery ward. Theatre recovery. You will stay in the theatre recovery area for a little while to make sure you are recovering well from the anaesthetic and surgery, and to make sure the medication given to you is controlling any pain you may be experiencing. Extended recovery ward area. You might then go to an orthopaedic extended recovery ward overnight, or you may be taken directly to the orthopaedic ward after leaving theatre recovery. The nursing staff will record your blood pressure, check your wound, and give you any intravenous fluids, known as drips, you have been prescribed. They'll also make sure that your pain is well controlled.
Okay, it's going to start now.
Later on, about 6 or 8 hours or so after your operation, if you are recovering well, the physiotherapists and perhaps the nurses will help you stand out of bed and take a few steps. This will be repeated again before night time.
Yeah. About taking a couple of steps and then come
All
back.
right.
Yeah?
Yeah.
Okay. Take a couple of steps forward for me. Okay, use your frame first.
The frame
Yeah.
forward first.
Frame forward first. That's it. Brilliant.
Same
Frame
again.
again. Yeah. Step into it. That's it.
Hello, my name is Sharon Waters and I'm a staff nurse on the Extended Recovery Ward. Some, but not all of our patients, come here to recover, particularly if they've had a long anaesthetic or have had previous medical problems. Once they're medically stable, they are then transferred to other orthopaedic wards.
Ward areas. On the first day after your operation, your temperature and blood pressure will be recorded regularly and a doctor will examine you. If you have been in the extended recovery ward, you will be taken to one of the orthopaedic wards to continue your care. A nurse will help you to wash and will check and dress your wound if required. A blood test and an X-ray may be taken during this day. You will be helped out of bed by nursing or physiotherapy staff, or both, and you will walk a short distance. The distance walked and the number of times you are walked will gradually increase as you improve. You may be able to go home on the first or second day after your operation if your consultant feels you have progressed well enough. Most patients will go home on the fourth day.
Hello, my name's Emma Prince. I'm a staff nurse on one of the orthopaedic wards. Hip replacement patients often continue their care on these wards until they're ready for discharge, often 4 days, sometimes less.
Before you are able to go home, the physiotherapist will ensure you are able to walk safely on the level and on stairs.
Your crutches forward a little bit. Great, we're going to start to go this way. And then your right leg. And then the crutches come up last. Excellent.
An occupational therapist will assess if you can do all you need to do at home, like having a shower, and will arrange any equipment or support needed that has not already been provided. The doctor will make sure that all your medicines are prescribed ready for your discharge home. The ward staff will arrange an appointment for you, if one is needed, from a district nurse, or an orthopaedic outreach nurse, or at your health centre, depending on which is most suitable for you.
All right, Paul. Right, ready to go home? Yeah. Marvellous. Got some things for you to take.
You will also be given an outpatient appointment for about 6 to 8 weeks' time post-operatively to see your orthopaedic doctors.
We've got some medicines to take home.
Once you have been given everything you need to take home, you will then go to the discharge lounge to wait for your family or friends to collect you from hospital, or to wait for hospital transport if that was required. After you get home. Once you are at home, you should continue with your exercises and walk as the physiotherapists have taught you. You may be telephoned or visited by one of the orthopaedic outreach nurses after you get home to check on your progress.
Hello Hilda, this is Jeannie from Orthopaedic Outreach. I'm just wondering how you've got on after your hip operation.
You will return to the hospital after about 6 to 8 weeks for your follow-up appointment.
That's wonderful, I'm so pleased.
Outpatient section. You will come to the clinic to see the consultant or one of the team, and sometimes an arthroplasty practitioner, someone whose special practice is with hip replacement patients. By this time, you should have recovered considerably from your hip surgery and be enjoying an improved pain-free mobility.
Hi, I'm Claire Stevens. I'm the Arthroplasty practitioner. I'm also an occupational therapist by background. My special interest is in the long-term function of people who have joint replacements, and you might see me when you come back to clinic for your first post-op check. We can have a good chat about how you've been doing and make sure that you get to return to all the things that you want to do after your hip replacement.
Thank you for watching this film. We hope you found the information useful, but should you have any questions, please ask the staff at any of the department areas that you will be attending before your operation, or ask the staff on the wards once you are admitted. Please bring the DVD back to the ward when you are admitted and give it to a member of staff so that it can be passed to another patient. I wish you a speedy recovery.